Welcome to the training session on updates to weekly COVID-19 vaccination data reporting for dialysis facilities. My name is Julie Siegel, and I work with the Division of Healthcare Quality Promotion at CDC. Today, we will be reviewing updates for both patient and healthcare personnel. May 11th of 2023 marked the end of the federal COVID-19 Public Health Emergency Declaration. However, dialysis facilities participating in CMS quality reporting programs will continue to report to the healthcare personnel and patient weekly COVID-19 vaccination modules of the HPS and dialysis components. Facilities are encouraged to report on a weekly basis, but only once during the calendar month is required. As a reminder, please direct any questions and/or concerns regarding reporting requirements and penalties or fines to CMS using the email address provided on this slide. The objectives for today's webinar is to review the simplification and changes to the COVID-19 vaccination reporting forms for dialysis facilities and healthcare personnel. Throughout the presentation, we will have an in-depth review of the upcoming form changes, the UptoDate definition change, provide example scenarios, and answer frequently asked questions. Please note, the slides from today's session will be posted to the NHSN COVID-19 vaccination website in the coming weeks. The form changes and up-to-date guidance discussed today will be available to users as of June 26 of 2023. On April 18, 2023, the Food and Drug Administration announced changes to its emergency use authorization regarding COVID-19 vaccines. Following this announcement, CDC simplified COVID-19 vaccine recommendations. These changes include CDC's new recommendation allow an additional updated bivalent vaccine dose for adult ages 65 years and older, and additional doses for people who are immunocompromised, allowing more flexibility for healthcare providers to administer additional doses to immunocompromised patients as needed. Monovalent or original mRNA COVID-19 vaccines will no longer be recommended for use in the United States. CDC recommends that everyone ages 6 and older receive an updated bivalent mRNA COVID-19 vaccine, regardless of whether they previously completed their monovalent primary series. For purpose of NHSN surveillance, beginning on June 26, 2023, Q3 2023, patients and healthcare personnel are considered up to date with their COVID-19 vaccinations if they have received an updated or bivalent vaccine. The form changes and up-to-date guidance discussed today will be available to users as of June 26 of 2023. Please see the link on the slides for further information. Let's start with an overview of how the weekly COVID-19 vaccination patient collection forms have been simplified. We will begin by discussing the patient form. Here we have a table overviewing the upcoming changes to the questions. In the first column, we have all questions on the current form. In the second column, we have which questions will be impacted by the changes for quarter 3. You can see there will be a significant reduction in questions and changes to current questions for the patient form. As you can see, the reporting summary form has been simplified. The major changes are to question 2 and 5 and removal of question 4. Information on how to complete the new forms can be found in the updated table of instructions. The image shown here is the new version of the patient form, which will be implemented on June 26, 2023. The most notable change is to question number 2, which is asking for cumulative number of patients up to date with COVID-19 vaccines in question 1, meaning how many residents have received the most recent recommendation for a COVID-19 vaccine. We will have a more in-depth review of the up-to-date definition change in upcoming slides. Questions 1 and 3 were on the previous forms and did not undergo any changes. Previously, these questions recorded why a resident did not receive primary series. Question 3.1 will be defined as not up to date due to having a medical contraindication. A medical contraindication will continue to be defined as a diagnosed allergy to the COVID-19 vaccine or to a component of the vaccine, or a severe allergic reaction after receipt of a previous COVID-19 vaccine. Question 3.2 will be defined as offered but declined vaccine required to be up to date. Question 3.3 will be defined as unknown up-to-date vaccination status. Now we will go over the HCP forms. Here is the table that overviews HCP form questions and where changes have occurred. You can see there will be questions removed, some modified, and some retained on the current form. To start, we will be simplifying the form by removing questions 2.1 through 2.2 and question 5. Question 4 will be modified to include the new definition of up to date. We will be keeping questions 1, 2, and 3 through 3.3. Unlike the patient's form, the HCP form will keep question 2, which includes the concept of primary series. As of now, it is required to continue reporting on the primary series for healthcare workers due to quality reporting program requirements. The quality reporting program measures will transition from primary series to up to date will likely occur later this year for most programs. Here you can see the new form. Question 2 has been changed to only ask about completed primary series, and question 4 has been removed. The most notable changes for the form are continuing to report on primary vaccine series for healthcare workers in question 2 and using the newest definition of up to date in question 4 for healthcare workers. A new footnote has also been added. This footnote states that the complete primary series as of June 26, 2023 is defined as receiving a 2-dose series of a monovalent COVID-19 vaccine, or a single dose of Janssen, or a single dose of bivalent vaccine. Now let's dive into the new UptoDate vaccination definition. Please use this definition beginning with quarter 3 of 2023. As stated earlier, on April 18, 2023, the Food and Drug Administration announced changes to its emergency use authorization regarding COVID-19 vaccine. Following this announcement, CDC simplified COVID-19 vaccine recommendations. For NHSN specifically, beginning on June 26, 2023, patients and healthcare personnel are considered up to date with their COVID-19 vaccinations if they have received an updated bivalent vaccine. The form changes and up-to-date guidance discussed today will be available to users as of June 26 of 2023. The images on this slide show the new questions on up-to-date COVID-19 vaccination status for both residents and HCP forms. Facilities will report the cumulative number of individuals who are up to date with COVID-19 vaccines. To help understand this change, I will turn things over to my colleague, Darielle Oliver. She will review various scenarios about the new up-to-date vaccination question added for both patients and healthcare personnel reporting.
Thank you, Jolie. I will now walk through these various scenarios. As a reminder, all patients counted in question 1 should also be captured in question 2, and 3.1, 3.2, and 3.3. As mentioned earlier, please review the up-to-date guidance document on the NHSN website for the current definition of up-to-date. Users should continue to review this document at least once per quarter for definition updates. Our first scenario has to do with Mary. Mary, who is 40 years old, is a patient who completed her primary COVID-19 vaccine series in May 2021, an original monovalent booster in October 2021, and an updated bivalent dose on November 3rd, 2022. Is Mary considered up to date? Yes, Mary is considered up to date for weeks during quarter 3 of 2023 since she received an updated bivalent dose. Where to document? Question 2. Cumulative number of patients in question 1 who are up to date with COVID-19 vaccines. Our next scenario is about Tom. Tom, a patient, completed his primary vaccine series on February 1st, 2021, and received a booster dose October 2021, but has not received an updated bivalent dose. Is Tom considered up to date? No, Tom is not considered up to date with COVID-19 vaccines for weeks during quarter 3 of 2023, since he did not receive the most recent recommended updated bivalent dose. Where to document? 3.2, offered but declined COVID-19 vaccine. Our next scenario has to do with Mark. Healthcare worker Mark completed his primary vaccine series on January 18th, 2021, and received an additional dose in June 2021, an updated bivalent dose in October 2022. Is Mark considered up to date? Yes, he is considered up to date with COVID-19 vaccines for weeks during quarter 3 of 2023, since he has received the most recent recommended updated bivalent dose. Where to document? 2, cumulative number of HCP in question 1 who have received complete primary series of COVID-19 vaccines at this facility or elsewhere since December 2020. And number 4, cumulative number of HCP in question number 1 who are up to date with COVID-19 vaccines. Our next individual is healthcare worker Jessica. Jessica did not complete her primary vaccine series, but chose to receive an updated bivalent dose in November of 2022. Is Jessica considered up to date? Yes, she is considered up to date with COVID-19 vaccines for weeks during quarter 3 of 2023, since she has received the most recent recommended updated bivalent dose. Where to document? 4, cumulative number of HCP in question number 1 who are up to date with COVID-19 vaccines. Our last scenario has to do with healthcare worker Harry. Harry received 1 dose of the primary vaccine series in February of 2021, and then received an updated bivalent dose in October 2022. Is Harry considered up to date? Yes, he is considered up to date with COVID-19 vaccines for weeks during quarter 3 of 2023, since he has received the most recent recommended updated bivalent dose. Where to document? 2, cumulative number of HCP in question number 1 who have received complete primary series of COVID-19 vaccines at this facility or somewhere else since December 2020. 4, cumulative number of HCP in question number 1 who are up to date with COVID-19 vaccines. We will now review some frequently asked questions for more general FAQs and example scenarios. These will also be included in the FAQs posted on the NHSN website. The first question is, when do the new form changes take effect? The answer to this question is June 26, 2023, or quarter 3, 2023. Beginning on this date, please use the new up-to-date definition when reporting COVID-19 vaccination data through NHSN. The second question asks, with the PHE or public health emergency ending, do dialysis facilities need to continue reporting COVID-19 vaccination data? If so, how often? The following charts provide the dates for which data should be reported. Question number 3. If a 66-year-old who has received a recommended bivalent dose in September of 2022, but no other doses considered up to date? Yes, per NHSN's definition, they are considered up to date. Please note that individuals who are 65 years of age and older or immunocompromised are eligible to receive additional COVID-19 vaccine doses because of the clinical benefit, but it is not mandatory. Whether or not the individual receives additional updated bivalent doses, they are still up to date. The fourth question asks, where do I document a healthcare worker who only received partial primary series, a single dose of original monovalent Moderna or Pfizer? On the new form, this individual will be documented in question number 3.3, unknown or other COVID-19 vaccination status. Let's summarize the main changes to the COVID-19 vaccination reporting forms that we reviewed today. The simplifications include the up-to-date definition on vaccination status has been revised. Patients and healthcare personnel are considered up to date if they have received an updated bivalent vaccine. For patients, COVID-19 vaccination data will no longer be reported for primary vaccine series and any additional or booster doses. For healthcare personnel, it is important to continue to report on the primary series, but no longer booster doses. We will now review how to access the additional resources that are available to facilities. The website listed on this page contains a variety of training materials, including data collection forms and instructions, quick reference guides, training slides, and information on CSV file upload. If you have any questions about NHSN, please send an email to user support at nhsn@cdc.gov. Please include weekly COVID-19 vaccination and the subject line of the email, along with your facility type. This concludes the presentation. Thank you so much for your time. We will now have the opportunity to answer questions.